Good day, folks. Alfie Venta here once again at Venta Pain Relief Clinic and VPRC.ca. I'm hoping you're having a terrific day. Welcome back to our soft tissue case study. This one's called Rowing Pains Part 1. We want to thank you. We hope you enjoyed the previous one, Big Toe Pain. That one was a bit more complicated, I think, than the previous two that I put out. Hopefully you'll enjoy this one also. Remember, these case studies are based on cases that I dealt with over the years. They could be a combination, and more than likely, they're a combination of different cases that are similar that I put together. There are rarely any one-offs in terms of just sort of like a certain case, unless it's very, very interesting. These cases are actually designed not just specifically for massage therapists. It's great if you're a massage therapist, but it's also designed so that chiropractors, physical therapists, physiotherapists can actually use the skills that they have in regards to working with the soft tissues. So let's talk about this case. Rowing pains, part 1. Could the shoulder issue be linked to the lower back and how? And remember, this is the first part. The second part is our answers and discussion, which will come out like in the next week or so. So let's talk about the case. So here we go. You meet your new patient client and you introduce yourself. You notice that she tends to put more weight on her right leg relative to the left. So you've probably seen this kind of posture where they're kind of leaning to one side. It's pretty obvious. They usually have their foot laterally rotated. So this is the posture that she has. She says to you that for a month now she has been noticing right-sided lower back pain and tightness, hip and right-sided shoulder pain and tightness also. So basically everything on the right side, from the shoulder to the hip to the lower back. She's also a competitive dragon boat racer. So if you've ever seen dragon boat, I've treated a number of people that were pretty intense in regards to their dragon boating. I'm not sure how popular it is these days, but I know like in the past, I think maybe 10 years ago, I had a number of patients that were actually involved with it. She oars on the right side, so I'm not sure what the oaring technique is, but basically she paddles on the one side. The shoulder pain is located on the anterior aspect of the shoulder, so right at the front here. At times, she feels that when she raises her right arm that there seems to be a bit of resistance versus the left. It's not that severe, but it's noticeable in terms of when she's doing that action, when she's maybe trying to get something from the cupboard. On her health history also, you notice that she has a 1-year-old child. If you ask her what side she tends to carry her child, she states on the right side. So she's kind of carrying the 1-year-old like so. And this is a very common one. This is also a very important thing to note as we progress through this case. So we're going to go on to the key observations. But I just want to add, if you like our content, please like, share, subscribe, and pass this on to those that you feel this might be helpful for. And if you're on YouTube, hit that notification bell. And by the way, if you are an instructor, we invite you, if you feel this is something that I think might be helpful I believe it could be helpful for your students. Myself, I used to teach way back in the day. I actually taught case studies at one of the massage schools in Toronto. So I invite you if you want to. So now let's talk about the key observations. The right shoulder is significantly more internally rotated relative to the opposite side. It's also a bit more forward too. I should have added that in. There's tenderness upon palpation deep into the center of the anterior deltoid of the right side. So when you palpate deep into the deltoid, the anterior deltoid here, there's tenderness felt. Right latissimus dorsi upon observation seems more developed than the opposite side. So going back to the anterior deltoid, the pain that she is feeling is more on the anterior side of the shoulder. So again, right lat dorsi upon observation seems more developed than the opposite side. Palpation of the belly of the muscle on the rib cage is tender and in certain specific locations seems to elicit referral pain down the right arm and a diffuse radius around the nexus of the pinpointed area. So at the root of that specific spot that you're on, it seems to kind of be diffuse in terms of the pain pattern. It is observed that the right-sided hip and pelvis seems to be more height relative to the left when patient is observed in a prone position. So when they're lying on their stomach, you notice that the right side seems to be slightly higher than the opposite side, or tilted in regards to the positioning of their pelvis. Using a pincer grip, so one of these things here, you access the thoracolumbar fascia from between the 12th rib and the pelvis. You notice how tight it is, and the patient client states that there is tenderness. This is relative to the opposite side. Generally, that area is going to be tender, but this one is a bit more tender than what is expected. It also seems that there is less spacing. Now, this is important too, that there's less spacing between the 12th rib and pelvis as compared to the unaffected side. So what I mean by the spacing is that when you compare the left side and the right side, when you actually try to go into the that area of the thoracolumbar fascia on the side of the rib there, you'll notice that it just seems like there's less room between that 12th rib and the pelvis. So it's kind of almost closed like this, okay? And that's relative to the opposite side. On palpation, the fascia is very tight, located on the right side of the inferolateral aspect of the rib cage to the iliac crest and towards the lumbar spine. So I have a little picture here for you so you can see what I'm talking about. So you see I've circled the area where the fascia is super, super tight. You see that's on the side of the rib cage there on the lateral side. And also towards the iliac crest and towards the spine. So you're going to find that on when you're palpating the area, the fascia is a lot tighter on this side relative to the opposite side. So the critical thinking questions I want you to think about for the next week or so is this. You can write this down on a piece of paper. You can put this in your laptop, plug it in. You're going to list 4 muscles that you would attempt to release. What are 4 muscles that you would attempt to release relating to this specific case? So what I want you to do is also list in terms of importance these 4 muscles, like, from number 1 being X, number 2 being this, and 3, 4, so on and so forth. What other structure or structures might you want to address on top of the 4 muscles? Is there something else that you think might be helpful in regards to maybe getting this person to become better in terms of their pain and discomfort? Of the 4, this goes back to number 1 actually. Of the 4, what muscle is potentially causing the most havoc? Explain your reasoning. So think about that. What do you think is the one muscle that you feel could be causing the most most of the problems with this person? And finally, explain the mechanics behind why you think your patient client became symptomatic. So the obvious thing is to go back to the video and have a watch in terms of some of the clues that you've been given, and then break down for me what the mechanics were to get to that point, the symptomatic point for this particular patient client. So there you go, folks. That is the case for you for this week. I hope you enjoyed this one, and I'm hoping that you will enjoy the answers and discussion video that we have. So it's coming soon. Like I said, it'll be sometime next week, and you can catch it on YouTube or LinkedIn. Thank you for watching. We really enjoy doing this. I enjoy doing this. I love sharing what I've learned over the years, and hopefully it helps you in terms of your practice. Please follow our social media, and also please like, share, subscribe, and ring that notification bell if you're on YouTube, if you feel our content is helpful for you. My name again is Alfie Vente of Vente Pain Relief Clinic and VPRC.ca. We hope you enjoyed this again, and we hope to see you in the next video for the answers and discussion. Have a good day. Take care.